people reach out to me on social media saying, I was told I'd never have a baby because I have PCOS.
So ridiculous.
And I just want to pull my hair out because
Yeah.
it's just absolutely not the case.
Today, we are looking at PCOS because it's PCOS Awareness Month, the month of September. And although you may listen or watch this podcast any old time of year, just know that PCOS, people are dealing with it every single day. And maybe some of you don't even know you have it. So we are so honored to have Dr. Lora Shahine with us today. Thank you for being here.
Thank you. It's an honor to be here.
So before we get into the meat of our topic, let's just share with everyone who you are. And I had the pleasure of meeting you several times now. The very first time was actually at the Integrated Fertility Symposium. I don't know if you recall this.
Absolutely.
And you were speaking, and I was very excited to hear you speak. And I loved how you were so open-minded in terms of integrating Eastern, Western, holistic types of practices just to help a person called our patients, right? And your specialty is in the realm of fertility because you are a reproductive endocrinologist and an OBGYN, is that right? The OBGYN
right.
As well, yes. And you are at the Pacific Northwest Fertility Center in Seattle. So thrilled to have you. And although you guys are hearing this first being aired on a Tuesday, I have to tell you that us moms are taking time out of our Sunday because we're committed to help you.
Right? We are that committed, yes.
Yeah. So thank you.
And passionate about polycystic ovary syndrome, PCOS Awareness Month. And Dr. Lora Shahine is also author of 2 books.
Yes, which I read. One is called Not Broken. And in fact, for those that want to look at it later, you can go onto my YouTube channel because I had originally interviewed you on Facebook Live, but now we uploaded it onto YouTube. So it just lives there forever, which is so awesome. And so it is, the post is number 53 for your book, Not Broken. And it's under my Fertility Talks YouTube videos, but it's under my name, which is at Meet Mary Wong. So check that out, okay? And I also interviewed you a second time, which is post number 93 for those of you who are interested and actually in the world of trying to conceive. We spoke about alcohol and marijuana and its effect on fertility.
Fun. Fun talk.
Very fun.
And now we're talking about PCOS.
Yes, and we just really wanted to shed light and bring hope to this condition because I feel like a lot of people get diagnosed with it or maybe don't get diagnosed with it. So maybe we should actually talk about that. Even what is PCOS? Can you shed light on what it is and when you find that patients often get diagnosed?
Yeah, absolutely. So PCOS is polycystic ovarian syndrome. And it's a very common hormonal disorder. It impacts 1 in 10 reproductive age women. It might be even higher than that because so many people go undiagnosed. But it's really a spectrum, collection of signs and symptoms. But traditionally, it's associated with irregular ovulation that leads to irregular and unpredictable menstrual cycles. Extra androgens or high male hormones that can lead to acne, extra hair growth kind of in the central portion of the body, or even hair loss. So think about like male pattern hair findings, and then also can be associated with lots and lots of follicles or little, fluid collections that hold eggs on an ultrasound. And so that's where it gets the name polycystic ovarian syndrome. Even though I think we should change the name because you hear the word cyst and it makes us worried. We think of cyst as being something bad. Yeah. So I think we should call it polyfollicle syndrome or poly-egg syndrome.
Totally agree.
And I saw your posts on social media. And by the way, if you don't know who Dr. Lora Shahine is, seriously, you got to follow her. She's awesome.
Yes, thank you.
Speak to that. And I 100% agree with you. I really don't like it. It kind of puts a bad taste in my mouth when it says polycystic, and polyfollicular just sounds more friendly.
Agree. Right?
Yes. So I don't know about your personal reproductive history, but I think it would be really lovely to have you speak to this because you
Sure.
have PCOS, right?
Yeah, so I was diagnosed late in the game because didn't fit the classic picture of PCOS, which is often people have this image of overweight, and because of the insulin resistance, and people experiencing, hairs on your chin, although I do have them. I don't necessarily need laser for them. And, but I did have cystic acne and irregular menstrual cycles. And, I went through an 8-year journey of trying to conceive and complete our family. And in that journey, I guess in the beginning of it, discovered that I have it. And so often I find that women will either discover they have PCOS through their facial hair or their cystic acne combined with the irregular menstrual cycles, or perhaps more commonly, they'll discover it when they're trying to reproduce or to conceive. Yeah. So we went on this journey and had 2 IVFs. The first one resulted in a healthy boy, which I have, and he's older now. And then our daughter, we conceived on the waiting for the transfer. It was Christmas time. And so it was a nice little pleasant New Year's January. Like, what, I missed my cycle again. I was actually really disappointed. I'm like, where is my cycle? I want to do this transfer. Turns out that I was pregnant. And so it was just like an amazing feeling after 5 miscarriages and 8 years of trying to finish everything and just finish the family and just move on. And but amazing. And I love the fact that in your book, you kind of bridge the Eastern and the Western together, because as a naturopathic doctor, I was just so resistant to get any help beyond natural health care. I thought I can do this, but 3 years after not conceiving, I thought, okay, it's time to stop being a hero. And I want to make sure that we give that message that, you don't have to be a hero. It's okay to combine the two. In fact, thank God for IVF. So I guess that's kind of my story.
So then let's address that then, because not all women know that they have PCOS. So I'd be interested to know, like, what percentage of the women that you see that have PCOS are actually diagnosed by you? Like, people walk around, they don't know that they have PCOS, right? A lot of them.
Yeah. I think a really very typical story is someone who is having irregular periods at a young age, late teens, early 20s. And they go to the doctor to sort of say, why am I having irregular periods? And very typically, a doctor will just put them on birth control pills, because that will fix the problem. And it makes the periods regular. Birth control pills also even out the hormones, so people will stop getting acne. And often the hair, chin hair and things will get lighter or go away. So it's sort of, we're definitely taught in Western medicine that if somebody has PCOS and they're not trying to conceive, just put them on birth control pills, because it's, that's all they need. It's definitely more complicated than that, but that's kind of what we were taught back in the dark ages when I went to medical school. So a lot of women, and they might not even get that explanation. It really depends on the doctor. A lot of doctors are really not well-versed or understand PCOS, including me. It's something I've really had to teach myself sort of later in my career. And so then they'll go off the birth control pills in order to try to conceive and get very frustrated that they're having irregular cycles. They often say to me, oh, well, I've always had regular cycles. And then I say, but you were on the birth control pills. And a lot of women don't connect the two and kind of understand that by taking the hormones and the birth control pills, you're building up a lining in the uterus and shedding it. It's not your own hormones that are communicating to make you have periods when you're taking birth control pills. So they go off the pills. They're having irregular cycles. They're not conceiving. They're often convinced that it's the birth control pills that messed up their fertility, and just kind of, it takes sort of putting a lot of things together to help come to the diagnosis and help them try to conceive.
Right.
It would be really nice to have that conversation early. It's to have that conversation when you get prescribed the birth control pill, for sure. So I love that you bring that up, rather than, it just even explaining what are some lifestyle tools that you can apply to your life, perhaps while you go on the birth control pill for a few years, so that when you come off, you're in a better place. You're in a better spot, for sure.
So On that note, do you advise certain lifestyle and dietary changes for your PCOS patients?
Yes, I, when they come to me, they're trying to conceive, and if they're not ovulating regularly, we're trying to get them to ovulate. And I have a really, open discussion like, hey, I can get you to ovulate with pills like Clomid or Letrozole, or the brand name is Femara. But you could also try to focus on some lifestyle changes, just focusing on being healthy, thinking about the food that they're eating, trying to decrease the amount of, high glycemic carbohydrates. I do talk about losing weight if people are overweight, but I try not to really laser focus them on that, because it's a lot of emotional things that are tied into weight, and oftentimes people have been told that their whole life. And so there are actually studies that show that women with PCOS, if they do regular exercise, at least 30 minutes a day, at least 5 days a week, without seeing a number change on the scale, they'll actually have better insulin use in their body, and actually can sometimes start, regulating their cycles just with regular exercise, good diet, sleeping well, managing stress. But I also say, like you said, Tanya, like try that for, 6 months, 8 months, work with an acupuncturist or a naturopath that might be able to guide you better. It's not really my area of specialty. Work with a nutritionist that focuses on PCOS. And if you aren't pregnant, come back and we can do some simple things. I'm not saying that, we can't help. And oftentimes by the time people get to a reproductive endocrinologist like me, they've been trying for a while and they're like, okay, I will do the lifestyle stuff, but just, get me to ovulate. Give me the pills.
Right.
So
I always joke around with my patients who come in and they get diagnosed, and I say, why would you want to squash your libido and go on the oral contraceptive pill? Let's regulate you, fix your acne, get your acne under control, improve all the symptoms, get you regularly ovulating, and just embrace you as a woman with PCOS. I mean, I know it doesn't go both, it's both ways. Some women will suffer with a low libido, but there's certain positive spins on, I guess, every condition. So it's just really important, I think, the conversation to have, the birth control pills not be all end all, and that there's so much that you can do, like you said, nutrition and exercise. We even talk about in our when to eat or when to nourish. The intermittent fasting is really, really helpful, especially when there's women who are overweight with PCOS. And, like you said, you don't have to achieve this big weight loss if you are overweight. It's just doing the tools, applying the tools to your life that actually will improve your metabolic parameters and insulin resistance. And it's just, and then 5%, I think, is the stat. 5% of a weight loss will sometimes, create ovulation and a healthy pregnancy. So it's just really trying to inspire hope that also, what's the stat? Do you know what the stat is in terms of women with PCOS who actually do experience subfertility? Because I think a lot of people assume it's like, they have PCOS and now they're doomed to struggle.
Oh my gosh. And so many people are told that when they're teenagers, they might get the diagnosis and then they're told, you're not, people reach out to me on social media saying, I was told I'd never have a baby because I have PCOS.
So ridiculous.
And I just want to pull my hair out because it's just absolutely not the case.
Exactly.
And there's so many tools that can help people, or just like you conceived naturally, right? Like, just because you have PCOS, it doesn't mean that you can't conceive.
No.
It might take longer, especially if you're not ovulating on a regular basis. If you only have, 3 to 4 ovulations in a year, that it could take a lot longer. So there's things that can help. One thing is I often give resources. I don't know what resources you guys use, but I really like 2 books. One is Fiona McCullough's book, Steps to Reverse Your PCOS.
She's my bestie. I love her.
Oh,
I recommend her book all the time.
I
she's
learned
great.
so much from that book.
Yeah,
I learned so much, more than I did in medical school.
Oh,
and
amazing.
Then,
and so wait, let's tell everybody that Fiona McCullough is also a naturopathic doctor, so not Western medical doctor. So I love hearing that as a physician, you learned through a naturopathic doctor.
Yeah.
Like, how awesome is that? Yeah.
You can't ever stop learning. Believe me.
100%.
Yeah. And especially just, I I do believe that there is so much to the lifestyle changes and how you eat, and the educating yourself about it is so much better than just like getting a handout from a doctor's office. It's like, okay, stop eating white rice.
Absolutely.
It's so much more than that.
Yes, yes, yes. And so we will be interviewing Dr. Fiona McCullough in our future episode, for sure.
I will watch that for sure.
Yeah, and share with everybody. And, the conversation's going to be beyond fertility, because as you know, PCOS is not just within the fertile years, or just, having difficulty, reproduction. And there can be ongoing things, other health challenges, right? Like, higher risk of diabetes, heart disease, stroke, all of that, right? So
I loved your TikTok on that. It's not it is not just a reproductive problem. It is an endocrinological problem that persists beyond the fertility years and into menopause. And some women, you were saying actually today, tell us, when that one patient who had three children, I should say.
Right.
And then discovered.
Yes. So she had 3 children, no problem. And only this year, in fact, like when I spoke to her, it's like within that month, she found out in her late 40s, that she had PCOS, and she's flabbergasted, and she doesn't know what to do with it, because she has other health issues. So she does have now type 2 diabetes. She does have joint pain and aches and all that. And so it's like, no, guess what? It's never too late. Learn about whatever you have, and then take charge of your body with knowledge, right? Like this.
And what was the book that you had mentioned? Sorry, you had
second book.
Two. So,
and then the other resource.
I like the Hillary Wright's book. It's called PCOS Diet, and then it explains a little bit more after that. I know the word diet is a trigger word for people, so I just want to make sure it's not actually telling you to diet or lose weight. It's just like Fiona's book, in that it's a lot of explanation. But then the second half of the book, really does have recipes and sort of meal plans and things like that I thought were helpful. So they kind of, she's a nutritionist and Fiona is a naturopath. So I like the 2 books kind of looking at it from 2 different perspectives.
I love that. We'll include it in our show notes, so that when you, after you hear this, you can just jump onto our website, which is embraceyoufirst.com, and we'll have it all there for you.
Did you read the study? Yes, thank you. That's awesome. Did you read the study that I just have it in my head, and I just want to throw it out there, that a few years back, that showed that with age, PCOS can kind of regulate itself a little bit, gets a little bit better, cycles start to regulate on their own. Again, just trying to inspire hope for patients, so that although there are these risks, if you're following all the lifestyle tools, and just with age, that it can get better. Did you read that? I don't know.
Oh, absolutely. And that I see that with my own patients, people who say, at different stages in life, my symptoms wax and wane, that at some stages I'm having a year or 2 of completely regular cycles and my acne clears up. And then I'll have, a year of just really strong symptoms. And if you really have them keep a journal and kind of think through things, you'll see that very often it's when they've gained, 5 to 10% of their body weight, that the symptoms come back really strongly, or they do change their diet, get a little bit more relaxed and enjoying the, ice cream and white rice, and then they'll see. And so I think it's just really, it's such a frustrating thing, because, so many people with PCOS are like, I just want my body to work. Like, I just want, to have regular cycles like my other girlfriends. And it's sort of frustrating. But I think everybody should be focused on being healthy, and, the things that are recommended, eating whole foods, avoiding processed foods. These are all things that can really help us all. I don't think it has to, I don't want people with PCOS to feel like they're carrying around this huge burden, that if they didn't have PCOS, they wouldn't have to pay so much attention to their diet or weight. I'd like it to be more of a empowering thing, and learning that if you can focus on health at a younger age, maybe you're younger and you're trying to focus on ovulating, but that will decrease your risk of heart disease, type 2 diabetes, and more as you age. I would like for that. I try to focus on that too. You got this diagnosis early. And so, yes, it sucks, but you know, let's think about the long-term implication. I'm so glad we found this out now.
Yes. I like to use it as a red flag and educate my patients too. It's like a nice red flag to keep you in line, and you'll be healthier just because you caught it early, you know, or even no matter where you catch it, just that flipping the positive spin. It's like a red flag to keep you in line. So
I want to just add in there, you know, when we're talking about the lifestyle and dietary piece, right? So there's also the mindset and the emotional piece, because oftentimes we may stop exercising and we may not eat as well if we're emotionally distraught. And certainly, you know, in the days of pandemic right now, it may exacerbate this kind of issue. So we want to be mindful of that piece as well, right?
Yeah. What are some things that you tell patients, for example, if they are going on an IVF journey or struggling through fertility? Are there any strategies that you kind of can give them, or guidance in terms of how to flip a positive spin on it? Let's say they have an unsuccessful IVF. So one of the things that I said was I decluttered my eggs, because when I had an unsuccessful one, I was like, well, you just decluttered the unhealthy ones. And
that's a good perspective.
That's great. I'm getting some tips here. I can hear myself now saying that. I didn't want to make it look like it was like a waste, because I was like, okay, well, what was the purpose of that second IVF? I had a bunch of miscarriages with the transfers and then got pregnant naturally. But then I was like, well, it decluttered and made space for this golden one, you know? And yes, exactly. I love that. I really do. I love that you guys are touching on the emotional aspect. You know, in the fertility journey and just PCOS in general, there's a higher risk of anxiety and depression. And it's hard to tease apart, is that a hormonal thing, or is it a frustration with their body not working like everybody else's? And so if you combine PCOS and fertility and an IVF journey, and, you know, these things can really build. And there's already so much shame and guilt, unfortunately, still in the infertility world and doing IVF. I'm so glad that people are talking about it more, and even talking about PCOS more, so people don't feel so alone. And so I really do pay attention to the mental and emotional impact. I kind of tell my patients, you know, IVF is one tool. I can help with that, but we really need to think about how you're taking care of yourself. Don't become a martyr in this process. Don't remove everything that brings you joy, you know. And, you know, in Jill Blakeway's book, she talks about that one Chinese proverb that says, you know, perfection is 80%. So if you can follow this great diet, you know, and exercise 80% of the time, you're winning. You know, that's perfection. So have that ice cream every once in a while, have that glass of wine every once in a while. You know, don't lose yourself in this process, because people lose themselves, they lose relationships. You know, if you don't take care of yourself along the journey, it can be long lasting implications.
You know, thank you so much for addressing this, because it is so important. And then my little add in for that 20% where you succumb to chips or ice cream or whatever your vice is. The thing is, please, when you do that, don't then become or feel guilty or have shame around doing it. Right?
Great point.
So, because otherwise then that doesn't help you anyway.
Yeah.
Right?
You can just get right back on track the next day. Yeah. Tomorrow's a new day.
Yeah. And you know,
and it's okay to just enjoy it in the moment and not think that it's a bad thing that you did it. Just, you did it and you enjoyed it and let go of it. And that's it. And then you can have it again another time.
Yeah, exactly.
And it's okay, because we don't want to be perfect. And the funniest is, you know, being a highly accomplished type A, everything gets done, you know, 90% high school average kind of gal over here who thought everything, like, I put my effort in and then it happens. And then I encounter some fertility and think, I guess it doesn't work that way, where you put your 100% in and then you get the output. So it's so important on the journey just to, like you said, I love that you say that, just to not totally like emerge in it and forget life. And I was guilty of that. I would go to the IVF clinic with a hat on and shades and, like, you know, hiding and not wanting and actually I remember sitting right across from a patient thinking, wow, you know, this is interesting. And she was staring right at me. Wearing my
Did you
shades
say
and
anything to
hat.
her?
No, but I did tell her after, because I thought maybe she was just being respectful. And I said, you know, I was in the clinic the other day and I like kind of shared some of my story with her. And she goes, I didn't even see you, but thank you for sharing. That just makes me feel more connected. Because I was just going through this like embarrassing, like, how come I can help other people, but I can't help myself? So yeah.
But that's your own personal judgment.
That was my own personal judgment.
Oh, I love that you're bringing this up, because so here's the other thing. People hide out.
Yes.
So I think, and you know, you raised this too. It's like, no, it's actually time to share and connect and have community around it. Yeah. Hence there is the whole PCOS awareness challenge, right? And we interview PCOS girls. So for those who haven't watched that, we did a podcast on PMS and how it's actually worse with PCOS.
Right. Yes.
Right.
Definitely. Yeah. PMS, and it's real. Yes. And it's worse with PCOS. So a lot of women experience that. So that's coming out soon. So just the concept of really not letting go, and even in relationships, I always encourage patients to, as women, just don't forget to orgasm, you know, and have intimacy outside of trying. Super important.
Absolutely.
Yeah.
One thing that people ask me a lot, and I'd love to get your input on it too, is how do they find a doctor or somebody to care for them for PCOS? And people ask me this a lot on social media too. And even though I'm a reproductive endocrinologist and I diagnose PCOS a lot, most fertility doctors really help people build their family, you know, get pregnant, and then they don't care for people long term. Like that's just not built into my practice.
Right.
And, you know, there are very few primary care doctors, OBGYNs, people that kind of really care for PCOS long term. In our, you know, area, there are a couple of endocrinologists. So I'm a reproductive endocrinologist. I focus on IVF and fertility, but endocrinologists are sometimes really helpful. And I'm just curious, and I do refer to naturopaths in the area that have a real
perfect
area of interest, because I feel like there's more long-term care, and it doesn't usually come from the fertility doctor.
Right.
Yes. So yeah, I agree. And I do believe that naturopathic doctors are really great. Chinese medicine practitioners are also great at that. We look at the body in a slightly different way, but you know, so for example, I'll just give you an example in terms of acupuncture, even with regards to trying to help with regulating the menstrual cycle. You know, when we're increasing blood volume to the ovaries, sometimes that in of itself can help regulate the cycle. I witness it, right?
And reducing cortisol and stress hormones.
Yes, which also aggravates the condition. Right?
Yes. Yeah, my cycles were always the longest when I was stressed, for sure. Delayed ovulation. I feel like just getting a team around, like, so having a team of people to help you, no matter even if you have PCOS or not.
Yes,
it's always nice to any condition, just to have a team of people, like to have a naturopathic doctor is huge, especially if they're using lifestyle medicine, you know, the evidence-based lifestyle medicine. So nutrition, exercise, sleep as the foundation, and mindfulness. And then secondary to that, you know,
so I'm going to jump in, and I'm not going to say secondary to that because I'm in a Chinese medicine.
No, I mean secondary to that, like supplementation, but with, no, I just meant in terms of, as a naturopathic doctor, I just mean secondary to, ideally find a naturopathic doctor who really knows about PCOS and the impact that lifestyle medicine has on it, but also have your whole team of traditional Chinese medicine practitioner, massage therapist, you know, just people in your,
and
on your side. And of course, and that's, endocrinologist. And then of course, reproductive endocrinologist if you need one. Yeah.
That's great. I just want women to hear that when they listen to this, because I think so many of the times women might ask the one doctor that's in front of them, and they're like, you know, I don't know, you know, and then women don't have the knowledge that there are people out there that can help. So I just want to make sure that they know that just because one doctor says, I can't really help you, it doesn't mean that there aren't others out there, you know.
Even nutritionists. Oh, sorry.
Yes.
Nutritionists are awesome, right? So the ones that specialize in PCOS.
Yes. So So just to educate a lot of people out there, depending on the jurisdiction, there are actually a lot of qualified people that they may say special interest in, because in fact, we're not allowed, like here, I'm not allowed to say I specialize in fertility or I specialize in PCOS. Like, we're just not allowed to say that.
Special interest in. So we can't say that we specialize in it, but we can say that we have a special interest in it.
Right. And so not all naturopathic doctors and not all TCM practitioners do this. So, you know, if you're whatever jurisdiction you're in, you want to check out who actually is well-versed in it and looks up the research and sees many people that has this condition, right? That can guide you fully.
Absolutely.
The other point is actually, women with PCOS who never will have a regular menstrual cycle can still get pregnant with or without reproductive endocrinology.
I actually find that women who, in my clinical practice, who are the ones, and I mean, I don't know if you see this, Dr. Lora, but if when they are not ovulating at all, that once they do, they're the ones who get pregnant more easily versus the regularly irregular cyclers. Do you know what I mean? I don't know if you see that. I don't know if it's just a kind of a N of one or N of, or whatever.
Well, and I'm trying to figure out sort of why, I mean, for the people that aren't ovulating at all, you're really fixing that issue. And so there you go, you're getting pregnant. But for people who are intermittently ovulating, there might be something else that you need to address. That's the way I would think of that.
I think we actually want to address one thing, because you are a fertility doctor, and if you are in the place of doing IVF or even IUI, insemination versus in vitro fertilization, for those who do not know the lingo, there may be higher risks of ovarian hyperstimulation, right? Should we cover that? Just because
sure.
Right? So explain what that is and what one can do about it, and maybe some myths around it.
And I can share my story with it.
Oh, there you go. Okay. More stories. More stories.
I'm full of stories. I'm really healthy. I just like to be perfect, and overdo everything.
That's wonderful.
Yeah.
Oh, it helps to share your story, because then people feel less alone. So it's really great that you're doing that. So because there's so many follicles that are up for grabs in PCOS, polyfollicle syndrome, that we have now renamed it during this podcast. When you go to stimulate the ovaries, say for IVF, one of the best things about IVF is you are trying to get more than one egg out of the body, because not every egg is perfect. Typically, someone without PCOS might have, on average, 10 to 15 eggs that are up for grabs each month. And so you would get that many eggs in that one IVF cycle. People with PCOS can have 20, 30, maybe even more at some point. And so as a IVF doctor, if I know that somebody has this many eggs that are up for grabs, I really tailor the protocol. And my goal is to not get 20, 30, 40 eggs. My goal is to focus on, quality eggs and, hopefully less than 20, but sometimes you just do everything that you can do. Watch them very closely. They do not need as much medication. Like, the dose should be significantly lower. And then the biggest trigger of ovarian hyperstimulation, or OHSS, is often the trigger shot in IVF, which is the final shot that helps the final maturation of the eggs and allows them to come easily when you're doing the simple egg retrieval. And HCG is the traditional trigger shot, but that increases your risk of OHSS, and so ovarian hyperstimulation syndrome. So very often we'll use a different trigger in someone that's at risk. We'll use Lupron to help their own body release the trigger hormone from their pituitary gland, and that will decrease the risk of ovarian hyperstimulation syndrome. So it really is planning ahead and knowing that that person's at risk, changing the protocol, using a low dose of medication, monitoring them closely, and really, helping them through the process, because people with PCOS are at higher risk.
Yes. So then let's actually address to exactly what the symptoms are. So since you actually had it, why don't you tell us what you experienced?
So I experienced, actually, just before I jump into that, I just want to say that if you come to this place where you need IVF, what I like to say to patients is that it really just helps narrow down your window of trying of, let's say, 12 months or 24 months, because it's 24 follicles or 12 follicles, anywhere somewhere in between. Something a little healthier, maybe not too many, but it narrows down your window of trying over a 1 or 2 year process into one go. And just so that just kind of a bigger picture, like why IVF. And often a lot of those eggs, unfortunately, aren't the best quality with PCOS. So you're trying to really improve your chances and not keep, having that sad, I guess you could call it, failure every month when you're not getting pregnant. So now onto the OHSS. So what I experienced was I filled up with fluid to the point of I experienced moderate OHSS. I could say that it felt severe because I filled up and I felt I couldn't breathe. And so I sat up for a night. I looked 6 months pregnant, and apparently the severe version, you can, experience, I guess, kidney issues and such, but I didn't go there. And my fertility doctor was amazing in coming in as an emergency and then draining the fluids off of me. It was like 1.5 liters over a 2-day process. And she was joking with me. She's just like, yeah, your body just likes to do everything over the top. Like, it's just like, and it's true. Like, I'm just one of those people who loves to do my type A. And it helped me realize that, wow, the severe consequences, but it's such a low percentage chance that something like this can happen. It's like winning the lottery, basically. And I had overstimulated to the point, I think I had produced 30 eggs, but she used the same dose as I had used for my first IVF. So it wasn't, for some reason, I guess maybe having had a pregnancy previous, maybe made me more responsive and sensitive to the medications. And then I drained the fluids a couple of days in a row, and I was also pregnant with twins. So I think the high HCG, just like, how you were saying that the HCG trigger shot is kind of what triggers it. I had done a fresh transfer, and I think that extra HCG just kind of pummeled things forward. So yeah, it was pretty, you're looking at me like, oh my goodness.
Well, no, so I just want to address this then. So you were at a time when they were doing fresh transfers.
Yes, they were.
So now they don't do that. Like, no. So, if you're freaking out.
Yes, don't freak out.
Watching this, just say, oh, the procedures are different now. Yes. So there's less chance. Because listen, I had a patient, this is going back, over a decade, and she did have severe, and it's like barely 5% of the population that get this, but she was at a point where she was pregnant, carrying, and her life was at risk because her kidneys started shutting down and she was getting fluid in the lungs. But that does not happen
just
now.
The fact that you're hearing this story means you won't experience it.
That's right. That's right.
It's like the plane crashed. You're not going to ever get on it. You heard that story. It's not going to happen to you. Yeah. So it's good to be aware of it, but it's not something that will happen because the chances are so low. We don't do, transfers fresh anymore, generally speaking. And especially if you see that many follicles that have matured. So.
Right. That's right. Yeah. Because you were pregnant, your body was still seeing the HCG, that the trigger shot that I was talking about. And so your body wasn't able to recover, and your follicles just kind of kept making that fluid.
Yeah, the fluid was trying to go there. I drank a lot of sodium, and that really helped. So like B8 and ate pickles, because apparently when you have, and actually that's something you can do even if you're like, there's no fresh transfers and you're just trying to avoid any consequences from the trigger shot. And let's say you do produce and get a lot of follicles and get those retrieved, you can just consume, excess pickles, or lots of pickles, and not a nice healthier version of Gatorade, coconut water.
So this is where I'm going to interject and add in. We did a post, you and I, on Fertility Talks about McDonald's French fries.
Oh yeah,
because I don't know about you, Dr. Shahine, but I have on several occasions. It's like, so what's the deal? Do I have McDonald's after my transfer? I'm like, what? Yeah. And so really, have you had that? Have you had patients ask you this?
Oh, yes. Yeah. It is just, it's in the chat rooms and it's on social media, and I really don't get it.
I think it's the French fries were salty.
It's the salt.
It's the salt.
Right.
right?
Yeah.
Right.
But it's not appropriate for like most of the people, and especially now that we're doing,
not necessary.
It's not necessary, especially because we're doing frozen transfers.
Yes.
But we did do a post on this to debunk that myth. Okay, so watch that on Fertility Talks. I don't know what number it is, but I think it's just important.
Yes, it is a good thing to share.
Everybody's like, oh, great, I'm gonna get pregnant because I'm going to eat more junk food.
Right. Yes. And it got us along the line. The message got twisted. So I think people thought, oh, French fries are good. McDonald's French fries are good for my fertility. And that is not the case.
No.
Yes.
And then they actually moved on and said just McDonald's, period.
Oh,
and I'm like,
I got
whoa.
even that. Okay. Yes. So good thing to debunk for sure.
Yeah.
Nice to laugh too, right? Like, get to go from something serious to something fun.
Yeah, totally, for sure. So I want to add so you were talking about, Dr. Shahine, how the goal is actually not to like increase the quantity to like an insane amount, because really the goal is about quality, right? So in your clinic, it is still more about the numbers game. So you don't want to have so much that you have sub quality, but then, we want to address and add in our perspective of, well, then how can we help and augment this quality?
Right.
And maybe we address how follicular genesis, meaning the development of an egg, is not just, from day 3 of your menstrual cycle to when you do that Lupron or HCG shot. It actually starts way before. So we want to inject nutrition and oxygenation, what I call juiciness to the eggs, right?
Oh, I like that.
Yes.
I like that term.
You can borrow it. It's good. Right? And so there's lots of things that we can do, which we already spoke about, which is, in terms of how we eat and in terms of movement. And what we do, like with even Chinese herbal medicine or acupuncture, there's our Vigo abdominal massage. There's people that do, certain kinds of chiropractic techniques, osteopathy. There's just so many different directions, and there's no one right way and just one right for you.
Yeah,
right?
I think it's just making sure that all the lifestyle medicine is in there, and you're just getting enough rest and getting enough sleep for melatonin, for follicular genesis, which just means your follicles are developing properly, exercising, because the background reason for PCOS, or we don't really know the cause, but one of the driving forces is insulin resistance. So that's why I think it's like 50% of women by the age of 40, when they have PCOS, may develop type 2 diabetes. So when you as you were mentioning, eat low glycemic index foods and follow nutrition that's non-refined, or eat foods that are non-refined, you're actually improving your egg quality by doing that. And, so getting enough rest, eating the healthy foods, and then just working on the mindfulness aspect and understanding your condition, and, and teaming up with other people, or making friends with, other friends who have PCOS, so you can joke around about it and find out what's working for them, their strategies, and then finding the healthcare team that can help support you, for sure. And exercise has been my sanity, I guess you could say, through the whole process of PCOS in my life. So find your, the things that really impact you.
That's a great summary. It's perfect. I love that that you guys are pulling all of this together. And I'm so glad that people can find this resource.
Yeah.
Oh, thank you.
Well, and
thank you so much for coming on.
Oh, I know. We're so thrilled.
So
Again,
important.
like on a Sunday.
Right.
Our kids are like being quiet somewhere.
Yeah.
This is where we actually stick them in front of a TV.
Yeah.
And
because we like are like, no to technology, but this is the time. It's okay.
This is an important conversation, damn it.
Yes.
Right. So
That's great.
Thank you so much. Is there any other words of wisdom, like last words for people that have PCOS, that are going through life in general?
Well, we've said so much, but I think I really appreciate the empowering message that you guys are bringing out, like learning about your body and understanding and finding that team, and, reading resources. And I really do believe that women with PCOS need to be advocates for their own care, because it's not black and white, and everybody's symptoms are a little bit different. And so finding that team that can really tailor the nutrition, exercise, mindfulness, sleep habits, kind of to you, is really, really helpful.
Absolutely.
Yeah.
Good point.
And so when you're speaking about resources, I'm just going to add in PCOS Girl, GURL. She's a great person to follow on Instagram
And
as well.
PCOS Challenge.
And PCOS Challenge. Yeah. So for those of you.
And if you feel like donating, they're always needing extra support in that way financially or just your time. They're always looking for PCOS advocates to help out for sure, just to bring awareness. And they're doing very important messaging to the government to just bring awareness. And PCOS Challenge actually had teal be the color as of a couple of years ago as an association with PCOS. So thanks for wearing the color.
Yes. Trying to. Yeah.
And
anyway.
So much more. So yes.
Okay. So before we close off, let's talk about, we have a question for you, because this whole podcast is about embracing you first, right? It's like stop sacrificing for everyone else, because that can also be a great excuse for not doing the dietary stuff, not doing the lifestyle stuff, because we don't have time. So for you yourself, I'd love to hear, what do you do to fill your cup to help you, to give you self-nourishment?
That's great. So much. Like actually so much. And it's really taken me a long time to get here. I get a massage twice a month. That's why I couldn't do it later in the day, girls, because I needed to take time for me.
Yes. Love it.
So I love you, and I'm glad we made this work. But you have to. 5 years ago, I'd have been like, okay, sure, I'll cancel my massage and I'll do this.
Yes.
Didn't.
Thank you for sharing that.
I sleep is a huge priority. If, in my house, it's like mom o'clock. If mom is not in bed, between 9 and 10, it's a problem.
So you do sleep then? You do sleep then?
I do. Awesome. And, maybe I'll read or something, but I'm like in bed between 9 and 10 every night. I make time to exercise, not every day, but I try to. And, I've really learned how to say no to a lot of things. No to toxic people. Yes. No to, I can't do every podcast or interview, but so
we are honored. Hello.
Yes.
Thank you so much.
Yeah. So, making choices that are sometimes hard, but that I know that I need my time to recoup so that I can help my patients and be a good mom and be a good friend and wife. And
exactly. Yeah. And so saying the no without the guilt and actually knowing the why you're doing all this, right?
Yeah, exactly.
So awesome. So we love you so
love
much.
It.
We'll keep on. So for those of you who are not following Dr. Shahine, please do so. What is your handle on Instagram?
Everywhere it's at Dr. Lora Shahine, LORASHAHINE. So
that's right. That's
Instagram, good. TikTok, Facebook, Peloton.
Sweet!
Everywhere.
I love it. Yep. Join me for some rides.
Okay, very cool. Yeah, nice. So we'll put everything in there. Yeah, we're looking for more smule people.
Music,
to sing. Do you sing?
Oh no, but I could maybe do a tambourine in the background or something.
Okay, well, thank you so much. Gosh, I could just talk to you forever.
I know,
really.
Me too.
I can't wait to see you live one of these days because, gosh, with the state of the universe, we don't know when we'll be able to fly to the U.S.
I know. Well, thank you so much for having me. This is a wonderful opportunity.
Oh my gosh.
Thank you.
We really want to thank you. And you know what? I just want to add one more thing. I want to really thank you because I don't think I ever said this. When you spoke at the Integrated Fertility Symposium, I don't even remember how many years ago that was. Maybe 3 years ago.
Yeah.
And I stepped up to the mic to ask you a question. And I had no idea you knew who I was, right? And you just knew, and you're like, I liked your book. And I'm like, whoa.
Awesome.
That really freaked me out. And I just want to thank you for the acknowledgement because, we write our books like that, not broken, like it's meaningful. We have purpose behind it because we want to help you navigate your life in a more empowered way with choice, with advice that is based on research. So it's wholehearted and, and that's what my book was on too, like providing that hope. So it really touched my heart that you acknowledged it. So thank you.
Thanks, Mary. I really appreciate that. I love, amplifying other people. too.
Amazing.
That brings me joy.
Yes.
And I see that. We see that
women
because
empowering women.
Yeah,
And men.
Yeah, because you
building
actually,
people up.
You do these book reviews and you show pictures of these books, and I love that. So thank you for amplifying. You are awesome. Okay, guys, we could just keep on making our bubbles gonna get too big or something. We're gonna keep talking.
So please like this podcast, like this podcast or this YouTube video, depending on where you're watching, and please share and
subscribe for sure.
Yes.
So and we're saying this to you: subscribe and comment and share. We want this rippling effect so that we can help and empower more women, and we have to add men to it too. We're not going to just no discrimination.
No.
Happy Sunday, but everyone's listening. Happy any day.
Yes. Thank you.
Okay.
Thank you.
Thank you for joining us. Click subscribe, like, and share. Please comment and suggest topics you want us to cover.
Until next time, ask yourself, how are you going to embrace you first today?
For more podcasts, check out embraceyoufirst.com.
And follow us on Instagram, Facebook, and YouTube.